Good morning. I'm very pleased to be here with Gisela, with all those who make this broadcast possible, our sign language interpreter, and above all, with everyone tuned in to this briefing, and those who followed our daily COVID-19 updates, which will now take place on a weekly basis. We start today's briefing with the unfortunate news of the death of a 74-year-old female patient from the municipality of Marianao, Havana province. She suffered from some pre-existing health issues. The patient began to develop COVID-19-like symptoms on October the 9th and was immediately admitted to hospital, where she remained for the next 9 days. The patient tested positive for COVID-19 and spent 5 days in intensive care. Her body's reaction to the virus was unstable, and she suffered a group of complications which meant that she had to be intubated. However, after days of complications, and despite the best efforts of our healthcare professionals, the patient went into cardiac arrest. In spite of attempts to revive her, the patient sadly died. We offer our condolences to her family and friends. We are deeply saddened by this patient's death because we work hard to ensure that situations like this do not occur. Today, 2,062 people are hospitalized in Cuba. 1,091 are under observation. There are 681 suspected cases and 290 confirmed active cases. Yesterday, we processed 7,592 samples in our various molecular biology laboratories, some of which have recently begun testing, like the facility in Ciego de Ávila, while others are also scheduled to do so in the coming weeks. Of the 7,592 samples processed, 56 tested positive for COVID-19. That's 56 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 728,426, of which 6,118, or 0.84% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested over the past week. Yesterday specifically, 1,275 samples were tested from Pinar del Rio. From Havana, 4,029, Matanzas, 353, Cienfuegos, 149, Villa Clara, 308, Sancti Spiritus, 471, Ciego de Ávila, 433, Camagüey, 225, Holguín, 101, Santiago de Cuba, 102, and so on and so forth from all of the country's territories. All of the 56 positive cases diagnosed yesterday are Cubans, 46 of which are autochthonous, while 10 are imported. 40 or 71.4% of the 56 positive cases yesterday are confirmed case contacts. Regarding such cases, a new protocol has been established. Now, all confirmed case contacts and contacts of suspected cases must self-isolate at home, where they will be monitored by their local healthcare professionals. These individuals must also comply with a series of measures. They cannot leave their house, they receive periodic checkups by local medical staff, and they are tested for the virus. Meanwhile, confirmed case contacts or suspected case contacts are only sent to an isolation center if they are identified as suffering from certain pre-existing medical conditions, given their age, or due to specific personal or social characteristics that may influence how the virus could affect them. Anyway, Taking into account the 40 confirmed case contacts to have tested positive for COVID-19 yesterday, means that 92.1% of all confirmed cases in Cuba since the pandemic began had contact with someone who had previously been diagnosed with the virus. It has not been possible to determine the source of infection in 3 cases diagnosed yesterday. That said, the source of infection in 15 cases reported over the last 15 days is still being investigated. Yesterday, 10 people to have tested positive for the virus contracted it abroad, meaning that imported cases rise to 466. Of the 56 cases diagnosed yesterday, 24 are female, representing 48.8% of all diagnosed cases on the island, while 32 were male, representing 51.2% of cases. 40, or 71.4%, of the 56 cases diagnosed yesterday were asymptomatic at the time of testing. Overall, 61% of positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure stands at 60.9% of cases diagnosed over the last 15 days. By age group, one positive case diagnosed yesterday is under the age of 20. In fact, this child is under 18 years of age, for a total of 681 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 648, or 95.1%, have recovered from the virus and been discharged from hospital. Meanwhile, 12 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 31 are between 40 and 59, and 12 are over the age of 60. Of the 56 cases diagnosed yesterday, 19 belong to Havana, 12 to Sancti Spiritus, 11 to Pinar del Rio, 4 to Ciego de Avila, 3 to Guantanamo, 2 to Camagüey, 2 to Granma, 1 to the Isle of Youth Special Municipality, 1 to Holguín, and 1 case to Santiago de Cuba. The 3 cases from Guantanamo, the 2 from Camagüey and Granma respectively, the case from the Isle of Youth, the 1 case from Holguín, and the other case from Santiago de Cuba are all imported, and therefore do not count towards the municipality or province's overall confirmed case rate. Meanwhile, of the 46 autochthonous cases, 11 belong to Pinar del Rio, and the municipalities of Guane with 10 and Pinar del Rio with 1. The 19 cases from Havana belong to the municipalities of San Miguel del Padrón with 12, Regla 3, Cotorro 2, Centro Habana 1, and 1 case to La Lisa. The 12 cases from Sancti Spiritus are all from the municipality of the same name. The 4 cases from Ciego de Avila belong to the municipalities of Ciego de Avila with 3 and Venezuela with 1 case. Given yesterday's results by province, Sancti Spiritus has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 35.84. Ciego de Avila follows with a rate of 20.82, then Havana with 6.46, Pinar del Rio 3.60, Mayabeque 0.52, Artemisa 0.39, Matanzas has a rate of 0.28, and Villa Clara with 0.26. No new cases of the virus have been reported in the provinces of Camagüey, Holguín, Cienfuegos, Las Tunas, Granma, Santiago de Cuba, Guantanamo, and the Isle of Youth Special Municipality for the last 15 days or more. Cuba's rate therefore stands at 3.79 per 100,000 inhabitants over the last 15 days. To summarize, Of the 6,118 people who have been diagnosed with the virus thus far in Cuba, 290, or 4.7%, are active hospitalized cases. Of these, 285, or 98.3%, are clinically stable. Yesterday, as we reported at the beginning of this briefing, one person died as a result of the virus, meaning that the COVID-19 death toll on the island rises to 124, with a mortality rate of 2.02%, lower than the global rate of 2.83% and the regional rate of 3.26%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 24 people were discharged from hospital, a negative result when compared with the number of confirmed cases yesterday. 1 person was discharged from hospital in Havana, 5 in Sancti Spiritus, 1 in Villa Clara, and 17 in Camagüey. This means that, to date, 5,702 people, or 93.2% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients continue to be in a critical state in hospitals in Havana and Villa Clara. Meanwhile, 3 patients are reported as serious and being treated in hospitals in Havana. Yesterday, 1 patient in Havana passed from serious to critical, and another, also from Havana, passed from serious to closely monitored. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 384,198 people were diagnosed with the virus, for a total of 38,581,261 confirmed cases since the start of the pandemic. Yesterday, 6,105 people died of the virus worldwide, for a total of 1,093,140 COVID-19 fatalities and a mortality rate of 2.83%. The region of the Americas, which accounts for 47.61% of all cases worldwide, reported 126,786 new cases yesterday, for a total of 18,370,967 people to have been diagnosed with the virus. Meanwhile, 2,982 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 600,543 and a mortality rate of 3.26%. The United States continues to top the list of countries worst affected by the pandemic, with 7,916,100 confirmed cases and 216,872 COVID-19 fatalities. 59,386 people were diagnosed with the virus yesterday in the United States alone. Then comes India with 7,307,097 cases and 111,266 deaths. Brazil follows with over 5,140,863 cases and 151,747 fatalities. In 4th place comes Russia with 1,340,409 confirmed cases and 23,205 deaths. From the Americas, after the United States and Brazil, comes Argentina, Colombia, Peru, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, Costa Rica, and Honduras. These are the 15 countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba. and the world.